Hello everyone. Today we are going to discuss about PTSD, post-traumatic stress disorder. It is a psychiatric condition. The word itself meaning you can see post-traumatic stress disorder. After the trauma, you are facing some stress. After some injuries, you are facing some stress. After some traumatic things which happen in your life, and that can create some stress, and that stress is severe and severe and severe, and that creating an imbalance in your life means that is known as PTSD, post traumatic stress disorder. What is post traumatic stress disorder? It is a psychiatric condition characterized by anxiety, stress and distress. So these are all the three characteristic features of PTSD: anxiety, stress and distress. And this PTSD is caused by any stressful event. And I can't say this is the stressful event. We cannot specifically say this is the stressful event. Anything. The stressful event will be different from person to person. It will be different from individual to individual. Based on the studies, PTSD develops in about 1 in 3 people who experience severe stress. While coming to the symptoms, the major symptom is re-experiencing the trauma or pain. The thing which you experienced already is experiencing again in the form of flashback, nightmares, repetitive image or sensations, or in the form of physical sensations like pain, sweating, trembling, and constant negative thoughts. So what is this flashback? Flashback means an unclear or vivid experience, like traumatic experience happening right now. Something happened previously, it's happening again right now. That feeling is known as flashback, like watching a video of what happened. Sometimes the train accident means the train is coming and hitting, like that a feeling will come. The train is coming, like a video that is coming in front of you, that is trying to hit you. That feeling will come. And we cannot expect a starting and ending for this flashback. But flashback do not necessarily involve seeing messages or anything. But you will feel at the traumatic experiences in a horrible way, and you will get more anxiety again. What are the causes of this PTSD? The exact cause behind this condition is unknown. We don't know what is the actual etiological factor behind this condition, but there are some causes. Or what can create this stress? Accidents, any kind of accidents. Accidents or physical abuses, sexual abuses, domestic abuse, childhood abuse, exposure to traumatic events anywhere in the life, guys, anywhere in the life, anytime. Sometimes at that moment you will not feel anything. Later, when you grow, gradually, the problems will increase in your mind, and gradually the problems will comes out in the form of stress, chronic health problems, any severe health problem, life terminating health condition. Sometimes consistently you are admitting in the hospital, that is enough. Sometimes any health problems, severe headache every time, and that is disturbing your day-to-day activities. Childbirth problems like abortion, war, any kind of problems which is happening in the society. Pandemic, that is the best example right now. This COVID-19 is the best example for post-traumatic stress disorder. Tortures, any kind of tortures which you have undergone can create post-traumatic stress disorder. But actual cause behind this condition, we don't know. These are all some factors which can create stress or distress in the person. So again, guys, why it developed? Why this PTSD is developed? We don't know. We don't know the reason behind this. The exact cause behind this condition is unclear. But there are some theories or explanations are there behind PTSD to explain what is PTSD. Among that, survival mechanism is one of the most important and interesting thing. Survival mechanism is saying that PTSD is an instinctive mechanism which is trying to help us to survive from future traumatic experiences. So it is a mechanism which is helping us to overcome the future traumatic experiences, that will prepare us to focus and overcome the future traumatic experiences. So that is a theory using to explain PTSD. And another thing or fact behind this PTSD is high level of adrenaline. Studies have shown that people with PTSD have excessive level of stress hormone, that is adrenaline. This hormone normally will release when we are in danger. So for every people, when we are in danger, automatically this adrenaline will get released. But PTSD people will produce adrenaline even when they are not in danger. And this is the reason behind numbed emotions and hyper arousal experience of people who is having PTSD. So always that hormone level will be high in the people who is having PTSD, and this is the reason behind the numbed emotions and hyper arousal experiences of people who is having PTSD. Next thing is brain and brain chemical changes. Based on the anatomy, hippocampus is the area in our brain which is responsible for memory and emotion. In people with PTSD, this hippocampus appears relatively smaller in size. According to the researchers, these changes may be related to fear, anxiety, and flashback. If you have repeated stress, repeated flashback, repeated anxiety, automatically the anatomical structure of hippocampus will get change. And in people with PTSD, the size of hippocampus appears relatively smaller comparing to normal person. So simply we can think that, so while coming to a conclusion, I will tell you in this way that the small hippocampus or the small hippocampus may prevent the flashback, fear, anxiety or nightmares being properly processed. Normally everyone will get fear, anxiety, flashbacks, nightmares, everything in everyone's life. But we have proper hippocampus, so the brain will process that emotions, that memory, that things which is happening. But in the case of PTSD people, the hippocampus is very small. So what will happen? The small hippocampus will prevent this normal processing of the fear, anxiety, flashback, nightmares, etc. So the anxiety will increase and gradually leads to tragic life problems. So this is an interesting thing, I feel. So interesting explanation behind this PTSD. So brain, how hippocampus and brain is affecting when we have stress, anxiety or any stressful events. Next thing is management. How we can manage PTSD. Two things we need to combine together. First thing is therapy and second thing is medicine. Balanced amount of therapy and balanced amount of medicine. If we mix and give to the patient, we will get better results. And happy news is it is possible to treat and cure. We will get cure from PTSD. First step in the treatment process is assessment. While coming to the assessment, active monitoring is very important. So while coming to the diagnostic tool also, this tool we can use active monitoring of the patient. What is happening in patient? So while monitoring the patient, you can understand what is the person's feeling or they will communicate with you while you monitor the patient. Psychological support and advice is playing a major role in treatment. While coming to the therapies, CBT, cognitive behavioral therapy, especially trauma-focused cognitive behavioral therapy, will help the client to overcome the pains and problems. There will be a detailed conversation will take place between the patient and the therapist. And in the middle of the session, the therapist will make the client to realize what is happening around him. This is real. This is unreal. It is already happened. You have to come up. You should come back. Like that the patient will get an idea. Automatically the therapist will encourage the patient to gain self-confidence. So CBT is simply a talk therapy, but there are a lot of sessions, especially 8 to 12 weekly sessions will be there in CBT, and 60 to 90 minutes each sessions will take. One thing we need in CBT, that is patience. Patience, that is very important. In the first session itself, you need the result means it is impossible. You need patience. If you wait, if you follow the therapist rules, regulations, guidance, instruction, definitely we will get better result from CBT. And this trauma focused CBT is mainly using for children and young adults. Then psychiatric drugs. antidepressants, that is the main choice of drugs, mainly sertraline and paroxetine. These are all the two majorly licensed drugs for the treatment for PTSD. But other drugs like mitrazepine, amitriptyline, phenelcin also we will give for the treatment of this PTSD. They are giving better result also, but it must be given under the supervision of mental health specialist or a psychiatrist. But we need to combine medicine and therapy together to get better result. Next session of PTSD is complex PTSD. It is occur due to repeatedly experienced traumatic events such as violence, neglect or abuse. The same thing again coming and hitting you means automatically you will enter into a stage of complex PTSD. The symptoms will be somewhat similar to PTSD, but everything will be in the complex level. Feeling guilt always, difficulty in controlling emotions, dissociation, losing concentrations, physical symptoms like headache, dizziness, chest pains, stomach problem, self-harms, that is a major thing, will try to kill themselves, suicidal ideations, drug abuse, relationship problems, all these things we can see in complex PTSD in a high level. Emotional numbness, that is another thing which we can see in complex PTSD. Another thing is hyperarousal, feeling on edge. That means feeling on edge. Simply feeling anxious and difficult to relax. You are feeling anxiety. Okay, and you cannot come back from that anxiety. That is known as hyperarousal, and this hyperarousal leads to irritability, angry outbursts, insomnia, and other mental health problems. So I'll tell you one example how a PTSD patient will talk after the incident. Okay, I thought I was coming to the normal after the incident, but a few weeks after the event I began experiencing symptoms similar to heart attack, chest pain, dizzy spells. I thought I would pass out. So kind of feeling will come to the mind of the person, and the person will feel that the person would pass out. So this is the example for PTSD patient's conversation. If you do a conversation with a PTSD patient, they will talk in the same way. Now we will discuss some tips to overcome the flashback. If you feel flashback, like I told you what is flashback, the same incidents will come to your mind, but there won't be no perfection in the incident. Like train accident means that you will feel like train is coming and hitting you. The train is coming, the feeling will come. But it won't be in the same way. So once you feel flashback, what you can do to overcome flashback? Focus on your breathing. That is very important. Count like 1 to 10, 10 to 100, then take deep breath. Sometimes a touch or look at a particular object during the flashback will help to overcome the flashback. Sometimes ice packs on the back of the neck or head or the chest. Then tell yourself that you are safe, or tell the caregiver or the service user, the person who is giving care, tell them to repeat the word like you are safe, you're okay, or tell yourself that you are safe. Then comfort yourself. Keep a diary and write your feeling everything, and explain to the caregiver or the person who is giving care to you that what can help you to overcome the flashback. Then nothing is working means take emergency medication to stop the unusual activities of the brain. So this is about PTSD, post-traumatic stress disorder. Hope you understand, guys. Thank you.